Antidepressants help a lot of people, but there are side effects that most people are not prepared for. Hey, what's up guys? It's me, the Psychic PJC. Antidepressants are like the most common type of psych meds, but they do come with a lot of side effects. And a lot of these side effects, no one actually warns you about. They're all pretty common, but the good news is that they're manageable and usually temporary, and they're definitely worth knowing about. So in this video, I'm gonna go over 5 side effects of antidepressants that no one warns you about. Let's talk about it. This video is meant for educational purposes only and is not meant to be medical or career advice. Starting with the first one, decreased libido and sexual side effects. This is probably the #1 reason why most of my patients stop taking their antidepressants. A lot of antidepressants actually lower your sex drive. They can also cause delayed orgasm or like increased difficulty reaching orgasms, and it definitely affects all genders. Now, honestly, this can actually be a good thing for some people. For example, let's just say somebody is, like premature, and they can actually use the help with the delayed orgasm. I've actually had some patients tell me like they were taking an antidepressant, not really for the depression, but actually just to delay their orgasm. And there's absolutely nothing wrong with that. But yeah, definitely for most patients, they do complain of this sexual side effect, which I don't blame them at all either. A lot of times providers will skip mentioning this side effect unless the patient actually brings it up themselves. I mean, it is kind of awkward to talk to your provider about it, but it's definitely something you should know. This is one of the side effects that's actually not temporary. It lasts pretty much as long as you're taking the antidepressant. The good news is that if it comes too much of a concern for you, well, your provider can actually like lower the dose or even change you to a different medication that doesn't have those kinds of side effects. But the majority of antidepressants actually do have this side effect. And moving on to the next side effect, increased anxiety at the start. So antidepressants actually help with both depression and anxiety, but they can actually increase anxiety for the first couple weeks. That's because your body's basically getting used to the medication. Like it's a new thing that's in your system. So it's like, not knowing how to react. And then that causes you to get like increased anxiety for a couple weeks. You might start feeling like jittery or even like restless. So it can actually make your anxiety worse before it gets better. A way a lot of providers counter this is to actually prescribe you a separate medication that helps with like short-term anxiety. So you can take that medication for the first couple weeks while your antidepressant is like building up in your system. And then once your antidepressant gets to the point where it actually helps your anxiety, you can stop taking that other short-term medication. But yeah, this is definitely one of the reasons why starting low and going slow is really important. If you get started on a high or even moderate dose of an antidepressant right away, your anxiety might increase too much to the point where like you can't even handle it for the first couple weeks. So basically start low, go slow, and take the as needed anxiety medication for the first couple weeks. This increased anxiety side effect should be temporary and go away within a couple weeks. And then moving on to the next side effect, weight changes and appetite shifts. Now, this can be either weight gain or weight loss, depending on the antidepressant. I would say a majority of them actually lead to weight gain, while a few actually lead to weight loss. A lot of them will increase your appetite, which obviously leads to weight gain. This isn't like an immediate side effect though. It's usually like gradual, and you'll start slowly gaining weight within the next couple of weeks or months. And vice versa for the weight loss side effect of other antidepressants. Now, this can also be either a good thing or a bad thing. If you're someone who's like trying not to gain weight or even trying to lose weight, then obviously the weight gain side effect is bad for you. But if you're someone who's like maybe not eating as much due to their depression, then the weight gain side effects can actually be beneficial. And on the other side of things, if you're somebody who's maybe overweight or doesn't want to eat as much, you can take an antidepressant that has a weight loss side effects, and that's actually good for you. There's actually an antidepressant called bupropion or Wellbutrin that's actually used off-label for weight loss. I actually did an antidepressant tier list video, which goes over a lot of the side effects of each antidepressant. I'll put the link in the description if you want to check that out. But yeah, weight changes and appetite shifts are definitely a side effect of antidepressants that a lot of people won't warn you about. And then moving on to the next side effect, which is mania or hypomania activation. So this is especially important for people who are bipolar, because with people who have bipolar disorder, they go through mood shifts, like either they go depressed mood or manic mood. So if a bipolar person takes an antidepressant, it might just make them like so not depressed that it actually shifts them into a manic phase, which means they're going to start talking a lot more. They're going to have a less need for sleep. They're going to engage in more risky behaviors that they know they shouldn't be engaging in. So it's very important to know, like, if you have bipolar disorder before you start taking an antidepressant by itself. Usually for people with bipolar disorder, their provider will start them on a mood stabilizer first before adding on an antidepressant for their depressive symptoms, just for that sole reason of preventing a mania shift. There's actually a lot of patients I've encountered who have, like, no prior mental health history at all. And then they start taking an antidepressant and they start shifting into like a manic phase. And I'm like, okay, you probably have bipolar disorder then. But yeah, providers should always be screening their patients for any kind of bipolar disorder before starting their patients on an antidepressant. Because when a patient shifts into that manic phase, it can potentially be very dangerous. And then moving on to the last side effect that nobody warns you about, increased suicidal thoughts in young adults. Now, generally young adults means you're like age 24 or younger. But yeah, pretty much every antidepressant comes with a black box warning that warns people of this risk of increased suicidal thoughts in young adults. So this is definitely a side effect everyone should definitely know about. It does not mean that antidepressants cause suicide. It just means that it increases the risk of having suicidal thoughts. And a good thing about this one is that it's supposed to be temporary as well. So if a patient does experience this side effect, it should go away within a couple weeks. But yeah, this is definitely one of the most important, if not the most important side effect to watch out for in the first few weeks. This is one of the reasons why providers want to check in on you so soon after starting you on a new antidepressant. Like, they'll probably want to see you again in about 2 weeks just to see if you developed any of these thoughts or any other side effects. So I've actually had one patient who actually had this side effect. Luckily, it was in an inpatient hospital, so he could be like observed 24/7 for any potential suicidal, behaviors. But yeah, his thoughts actually went away after like a week or two. So that wraps it up for 5 side effects of antidepressants that no one warns you about. Now, this doesn't mean that antidepressants are bad or like unsafe, but every patient definitely needs to be aware of these side effects just so they can have better outcomes. If you're on an antidepressant and something feels off, just talk to your provider about it. It's always better to be safe than sorry. I want to know, have you experienced any of these side effects? Let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I do videos on psych stuff twice a week. I am also on TikTok and Instagram if you want to follow me over there at the PsychopDavidC. I do telehealth medication management for adults living in California. If you're interested in booking with me, there's a link down below. And with that, your mental health just leveled up. You're welcome.